Currently, 2.3 million hospitalized older adults in the United States are affected by delirium each year, leading to a total expenditure of $152 billion annually. Delirium, also known as acute organic brain syndrome, is characterized by an acute onset of cerebral dysfunction associated with fluctuating mental status, inattention, and either disorganized thinking or an altered level of consciousness. The occurrence of delirium is high in critically ill populations. Risk factors include hypoxia, acute infection, intracranial events, electrolyte imbalance, seizures, benzodiazepine infusions, metabolic disturbance, uncontrolled pain, withdrawal states, and dehydration. There are 4 features to the CAM-ICU. The first is to assess if the patient is different than their baseline mental status. Then you assess inattention. Thirdly, you assess level of consciousness. And finally, you assess for disorganized thinking. In order to diagnose a patient with delirium, they must have the first 2 features and either the third or the 4th feature.
Mrs. Smith is in for severe dehydration. She came in last night to the ER with tachycardia. Female, 25 years old, lives in the area. She has no known drug allergies. Vital signs are blood pressure 130/80, heart rate is 100, O2 at 95 on room air, temperature of 98.6. She rates her pain 6 out of 10 due to a headache.
Did you get her anything for the headache?
She has Tylenol PRN and I gave that at 5.
Okay.
She was brought in by her significant other. She was working out when she complained of heart palpitations and stated she did not drink anything prior to exercising because she was busy. She's orientated a person. She does not know where she is at, what day it is, or why she is here, or why she's in the ICU. She's currently trying to get out of bed without help. She is not combative.
Put a bed alarm on her?
I can't remember, probably not.
Okay.
She's not combative, and she needs to be reorientated frequently. She keeps asking why her IV is in, and at times tries to pull it out. She is eupnic, vital signs stable.
Where's her
Left arm, left
AC.
Left AC.
Okay.
She has 0.9 running at 25 mils per hour. You can call the doctor for labs, monitor vital signs, INO, O2 sat, maintain fall precautions, continue to monitor the BUN for signs of worsening dehydration, and call the doctor before you turn fluids up.
Okay. Oh, Lori, let's get you back in bed here, okay? Can you scoot up in the bed for me? Thank you. Perfect. My name is Ashley. I'll be your nurse this afternoon, okay? Let's not play with that. I gotta take this down later. Can you state your name and date of birth for me?
Lori Smith, 6/25/92.
All right. Do you know why you're here? Do you know where you're at? Do you know what year it is? One last question for you. Do you know who the president is?
Presidents?
Yeah.
I like Abraham Lincoln.
Okay. We're going to take a pause here, okay? So this is feature 1. She is oriented to self currently, where previously she was A and O times 4. So this section would be considered a yes for the feature 1. So for this feature, we are going to modify it slightly. Normally, the patient would have you squeeze their hand for a positive response, but for visual effects, we're going to have the patient tap on the bed so that you guys can see it. Alright, I am going to do an assessment on you, okay? I'm going to read you a series of letters. Can you tap the bed every time I say the letter A? Okay? Okay. So the first letter, S. A. V. E. A. H. A. A. R. T. Alright, so this patient was incorrect for more than 2 times, so this section would be considered a yes or a check for feature number 2.
Who are you? What are you doing?
Lori,
Where am I?
Lori,
Who are you?
Lori, I'm your nurse. You're in the hospital. You were admitted for dehydration, okay? Alright, so this is feature number 3, level of consciousness. Based off this patient's actions, she is not alert and calm, so she will receive a check for this section. Lori, I have to ask you a few questions, okay? Can you say yes or no to them? Will a stone float on water? Are there fish in the sea? Does 1 pound weigh more than 2 pounds? Can you use a hammer to pound a nail?
I need a hammer to get the fish out of the wall.
Alright, can you hold up this many fingers? Alright. Now can you hold up that many fingers on the other hand? Alright. So in this feature, she was unable to answer the questions correctly. Therefore, she's going to get a check in this section. Since all the features for this patient were positive, this patient is considered to have iatrogenic ICU delirium. Using the CAM-ICU tool is as follows. Feature 1 and 2 have to be present, and feature 3 or 4 must be present to be considered delirious. So to prevent and identify delirium, nurses must possess the knowledge and identify risk factors and incorporate their knowledge using the CAM-ICU screening tool.